Support for Radio Friends comes from Columbia Healthy Smiles, the dental office of husband and wife team Dr. Batson and Dr. Abe, offering comprehensive and customized care to patients of all ages. Learn more by calling 573-721-9039 or online at www.columbiahealthysmiles.com. Good morning. Welcome to Radio Friends on Wednesday, December the 22nd. We have only one half of Columbia Healthy Smiles with us today, Dr. Philip Batson. Good to have you here, Philip.
Thanks for having me, Paul.
And the other chair, Dr. Elizabeth Abe, she's back filling teeth. And
she's back manning the fort, and she's also, we're expecting right now, and so, there's a lot to juggle.
Yes.
And so she's kind of superwoman doing it all.
And that new baby is coming sometime in February, right?
Yes, sir.
Okay.
Yeah. Excited. Life's going to get changed quite a bit.
Okay. Today we're going to talk about implants. Now, I've been confused about what implants are. I thought for many years I had 2 implants, and you corrected me last month because I had root canal and I have 2 crowns, and I thought that's what the implant was. What is an implant?
So you're not alone in that confusion a little bit too. The implant, a dental implant, is a solution for when somebody has to have a tooth extracted or physically removed from their jaw. When a tooth has gotten to a point just where extraction is the only treatment available, and so a tooth is actually removed. And so the implant is a replacement for that tooth. And I like to call implants as man-made roots. They go down into a person's jawbone or upper jawbone, and then they will integrate with that jawbone over time. The bone and the implant do what we call osseointegration, and that's where your bone integrates with the implant threads and implant body.
So you put this screw into the jaw, and then after time, the bone grows around the screw and it becomes one.
It becomes solidified with your bone, so it's very stable, very stable for then to put a restoration on top of. So then what goes on top of a dental implant is a crown. So it's a three part process, or 3 parts. And it's a dental implant, which is what's in the bone, and that's what integrates with the bone to support it. And
okay, let me ask you this now. When that dental implant is put in, it's a screw, right?
It looks like on an X-ray. It looks like a screw.
So they've got an electric screwdriver. You got an electric screwdriver, and you're screwing it into the jaw, right?
Yeah.
Something
it's kind of like
okay.
that.
I mean, I'm making it very simple.
Yeah.
So you've screwed that into the jaw. Is there pain then after the sedation wears off and you're starting to eat? Or is it pretty much pain-free from the beginning?
It's a very comfortable process for the most part. A lot of people have more discomfort a lot of times with any of the gum surgery that might have to be done around it to get the site ready versus any pain in the bone or with the implant. They can be done under local anesthesia. So local anesthetic, so you don't have to be sedated or asleep for it.
It's like doing a filling.
We can do them with just the same type of anesthetic we would do a filling or a crown or a root canal with.
Then once you put the screw in, do you immediately put the new crown on top of that screw, or is there another process that goes on?
Case dependent. Sometimes you can do what we call immediate load the implant. That's a very case specific decision. You don't always do that because you don't want to have any dislodgement of the implant while it's healing. So most of the time what happens is we put what we call a healing cap on. It's a short little metal cap that sits way down right at the gum level. So sometimes you will have a space maybe in the back of the mouth. If you're replacing a molar, say, you might have a space there for a few months. A few months later, come back, check to make sure the implant has done what we say integrated with the bone. If it's good to go, then we can put the crown onto the implant, and then you have your restoration.
Okay, so it may take several months.
It can take anywhere from 6 months to 12 months, and that depends on healing time. It depends on surgery. Sometimes patients have to have bone added to a site to make sure the implant site is adequate to support an implant. So we have to do a bone graft sometimes, and that's addition of bone to a site.
Oh, is there ever a patient that is not a candidate to have an implant?
Yes. So sometimes if the site for where they want to do a tooth replacement has been without a tooth for an extended period of time, they might just be too deficient in bone to do any sort of surgery to even rebuild that site. Some medically compromised patients aren't good candidates. We have to be aware of patients on medications that are bisphosphonates. They have interactions with the jawbone. Sometimes, you have to be aware of uncontrolled diabetic patients, things that would affect healing and potential integration in any sort of surgical site.
But if you have to build the bone up, so then where are you getting the bone from that you're putting in there to graft it? Where you getting a bone from?
So there are different types of bone grafts out there. You can do a bone graft from someone's own jawbone, harvest that bone. That's not as common, but it can be done. There is donor bone from a human bone that's from a donor bone bank that is sterile and utilized. That's probably the most common type.
Now, from a donor who has already passed away?
Yep. Mm-hmm.
Okay, so if you want to be a donor, you can donate your bone, your jawbones?
Yeah, I believe so. I don't know the process of how someone would do that, but there are bone banks. There's just a couple major bone banks in the U.S.
I had no idea.
And so they supply the bone for
how long
grafts.
is the bone good for after a person has died?
Oh, that I'm not sure about that, because I don't know the process from that transition.
I had no idea that was done. That's interesting. So when you look at all of this, it can be a pretty big process, or it could go quickly. Is there ever a time when you say to somebody, maybe we should just leave well enough alone and not do the implant?
Absolutely. We talk about all the treatment options with patients when they want to replace a space or talk about implants. We get into all the discussions of leaving a space, of doing a partial, doing a bridge, doing an implant. They're all treatment options that we can discuss.
Yeah.
We just have to make sure the patient is informed, feels educated to make the decision they feel is best for them.
Yeah. Well, this was really very interesting to me. I had no idea that all of that went into an implant. I thought it was just as simple. You just screw a screw in there and plop a cap over the top, but there's more involved to that. Dr. Philip Batson, thank you so much for coming by.
Absolutely.
And if people have any questions or want any information, how do they contact you?
They can call us at 573-875-7071, or our website is columbiahealthysmiles.com.
You got it. Okay. And of course, the most important thing to do is brush and floss every day.
Absolutely.
Keep your teeth healthy.
Absolutely.
All right. Dr. Philip Batson, thank you so much for coming by.
Thank you.
And Merry Christmas to you.
Merry Christmas.
We'll see you tomorrow. Thanks for listening. Bye-bye.